Hello, I am Dr. Richa Gangwar, Senior Consultant and Director, Obstetrics and Gynaecology at Cloudnine Hospital, Gomti, Nagar, Lucknow. Gynecologist is a person that will help you listen to your body carefully. With regular gynecological checkups, you can take care of physical, sexual and reproductive well-being, including birth control, childbirth and menopause. To relieve the anxiety, I will today talk about the common procedure that would be followed that once you go and visit your gynecologist. So first of all, a nurse will take your blood pressure and measure your vitals. Next, you are allowed to enter in the gynecologist room and she will talk to you about your periods, any period problems, any pain during periods and also your obstetric history, the number of deliveries or abortions you have had. Next, you will ask to undress and lie down on a couch. She will then wear sterile gloves and examine your private area for any obvious signs of infection or any other lesion. Next, she will introduce tongue-shaped instrument which we call a speculum to look inside your vagina. The cervix is examined to see if it is healthy or if there is any abnormal discharge coming from the cervix. Next, the doctor will use a plastic brush to take the pap smear. This test takes the superficial cells from your cervix which are then examined to look for the presence of any abnormal cells as in cervical cancer or for the presence of human papillomavirus infection. Next, the speculum is removed and the gynecologist inserts her two gloved fingers into your vagina and with the other hand placed on the abdomen, she will assess the size of your uterus, its direction, whether it is anteverted or retroverted, any pain or tenderness if you feel during this examination. She will also swipe her fingers to look into the adnexa if there is any cyst or any abnormal swelling. Now you can get up from the couch and doctor will then assess if you need any vaccinations, any birth control measures or anything that might be needed. Your doctor will also examine your breast to look for the presence of any lump, any abnormal discharge from the nipples or any tenderness. Then she will also discuss with you any vaccinations you may need if you wish to prevent childbirth or if you wish to have a child.